I think without a doubt, the most depressing thing is doing a first take, it failing, and then you have to fake the reaction. You know, when you're doing a voice memo and you're trying to laugh and then you realize it doesn't record.
Yeah, a keen listener would have realized we've done that before with a joke or two, and it's just like, it does not hit. It's like, I've heard it before. The comedy is just not there in the slightest.
Exactly.
I think it's episode 3 or something that happened. It was absolutely shocking.
Yeah, it was episode 3. Yeah, that's true. But anyway, we were talking about, unfortunately, we got 5 minutes in and realized it didn't work, but we were talking about how this is our 10 subscriber special. So amazing news. We're looking forward to our 20 subscriber special coming up next episode. But in all seriousness, we're going to be chatting about something both Matthew and I are passionate about, but we haven't actually discussed much with each other, which is quite interesting in my opinion. And it's talking about what you should do, how you should navigate the whole scene of being a dietitian and someone, I guess an authoritative figure in food and nutrition, how you should navigate having discussions with other people when they're talking to you about food and nutrition. For me, I'm not sure, Matt, what you get, but I get a lot of people telling me that, oh, this food's healthy for you, this food's great for you. And it's always coming from a good place. But I do find it interesting and I enjoy navigating those conversations. What's your experience, Matt?
Seeking of validation is often quite prevalent. It's like, oh, yeah, I follow insert socialite here, insert food thing here. I follow Gary Brecker, so I know everything about methylation. I follow Dr. Mike Israetel, so now I'm a sports scientist. Like, it's sure. Well, like, let's go through and then let's have a bit of a discussion. It's like, okay, why do you think those things? What's going on? And then we had this topic come up last episode of Max, take it away.
Yeah, so I think firstly we've got to differentiate between, and I think you put it really well, differentiate between firstly when you've got like friends or family, I guess, and then you've got people that you don't really know, maybe strangers or people that you're not, maybe acquaintances or work associates or whatever, and you've got clients and people who are coming to you for advice. Would you say they're the 3 main categories?
Yeah, generally. And then you get the very odd internet comment where it's like, oh, I've heard this, or like they'll tag someone else and it's like, hey, can you get a vibe check on like, is this actually accurate? And it'll be like some random fitness influencer being like, you should go on a 1,000-calorie diet, it's good for you, and it's like, shut the fuck up. But anyways,
love it. No, yeah, and that's an amazing 4th one. So take me through, Matthew. First one being friends and family. How do you navigate those conversations when a friend comes up to you and says, oh, Matthew, have you tried this new turmeric? It's amazing for your health. What are you doing?
Generally, it depends on the level of relationship I have with the person, and more importantly, what level of receptibility they are in terms of can they receive feedback? Are they open to criticism, open to conversation? And more often than not, even when they say they are, they really aren't. They're more so just looking for a validation. And it's very tricky because you're seen as an authoritative figure on the information on food. Is it, in quotations, healthy or not? Can I get the pro from you, like, go ahead, or is it hey, you need to hold up and pause with your entire journey on health and reevaluate everything? Often it's quite messy, so I often just try to lay out the facts as best I can. But even then, look, it depends. So let's go with the assumption of I'm talking to a very close friend of mine, been friends with them for absolute years, can tell them anything, no problems at all. It's like they come up to me, hey man, heard about this different form of creatine. I've heard it's better than normal creatine monohydrate, and then it's a little bit more expensive, but the more expensive is because it's harder to produce and it does something to the muscle, this and that, blah, blah, blah. And then we kind of go through and like, oh, okay, why do you think that? And then try to guide them to the conclusion that I already have, where it's the statistics aren't there, the data isn't there to support XYZ that you're kind of painting towards. It's kind of copium. It's like, yeah, because it's more expensive doesn't necessarily mean it's more better. Like you have some luxury brands. Like I personally think all Ferraris are trash, but that's just my personal opinion. But in the same sense that if you have an expensive version of creatine, it doesn't mean that it's necessarily better than the base version of creatine. We have to go through the steps of, does it pass the smell test? Does it smell funky in terms of like, is it too good to be true? Is it so boutique that it's only one supplier that has it and nobody else can make it in this specific way or something along those lines? That's why it's so expensive, and it's somehow the entire rest of the health industry doesn't know about it and the top sporting performance teams aren't using it. And it's like, okay, well, then we've got to jump through multiple different logical hoops to get there. And then we're getting to the final point. I'm like, okay, so with all that information, do you now think that what's the probability that this thing actually does what it says it does? Is the tumor going to cause reduction in total cancer risk? Is the inflammation even bad in the first place? Or kind of jumping around in terms of a lot of different, let's say, foundations of knowledge that need to be established before we can come to a conclusion that actually works for them. Because if I just tell you, like, I don't know, let's say you come to me, Max, you telling me, hey Matt, what do you think about this? I'm going to tell you straight up what I believe, but you're also aware of what my thought process is, and we don't have to investigate it further unless I'm unsure about it, and then I'm very honest. Then of course it's exciting for us to investigate it. But I'll just tell you, and you'd be like, cool, end of story. That's all I need to know moving forward. But if it's someone who, let's say, likes to think of their own, and then likes to, let's say, do their own research, which I absolutely encourage. You absolutely should do your own research. Don't listen to one person, me included. It's about ensuring we can find the outcome that we're looking for and not be biased in our approach to that situation. Now, that's not majority of people, I would say, I come into contact with. I would say the majority of people, it's very, very delicate in terms of how you approach that situation. Often it is just looking for a validation. It's like, I take care of my health. I take turmeric, creatine, omega-3s. I take vitamin D daily. That's good, yeah. I'm like, well, it really does depend on the situation. I usually give a very vague answer. I'm like, I normally don't provide that kind of information unless I have a full consultation, because I don't know your entire story. I don't have a client-patient relationship form with you. I don't have a client history. I don't have an in-depth analysis on what's actually going on behind the scenes. I usually don't answer the question with a yes or a no, or what they can infer with a yes or a no. I usually answer it with, oh, that's really interesting. Or, I haven't really heard about that much. I'd love to learn more. Can you tell me about what you think about it? And that's usually enough to provide that, okay, he's actually interested in what I'm saying. This is a good conversation, but I'm not shutting them down or confirming what their position is. Sorry, that was a very long-winded answer, but does that make sense?
That's absolutely fine. I was so convinced I was going to have to resend to you. The whole time I was thinking, how am I going to gently resend to Matt here? So he actually answered the question, but you got there in the end. He actually did answer it in the end. I was thinking the entire time, I was like, okay, I'm like, thank you for this beautiful answer, Matthew. Let's just resend it back to what I actually asked you. Yeah. But yeah, no, 100% agree. And it's really interesting that we get to the same conclusion, even though we've never actually discussed this before. Because for me, I really differentiate when I'm talking to friends and family as to whether they've told me a statement or a matter of fact as per them, or a question, because they're two very different sounding types of things. So a statement will look like, how amazing is turmeric? It's so good for your health. And just like you replied, it'll be, oh, maybe it could be something like, if I'm being a little bit more condescending, you know, someone says, oh, milk is awful for your health. I'm like, oh, I haven't heard that one before. That's pretty interesting. In more of a condescending way, I guess, you know, because I'm not going to engage in that type of conversation. Or if it was just the turmeric one, for example, you know, how amazing is turmeric for your health? Yeah, it's so interesting, isn't it? Kind of thing. And just moving forward rather than always having to challenge people. And then if someone obviously asks you a question, then I guess for me, I always have a genuine answer for the question. Like if someone wants to actually know something and they want to ask a genuine question about, you know, do shakes help you lose weight? Of course, I'm going to give you a very thorough answer because you seem like you're actually curious and you actually want to know. Do you fall into the same category between differentiating those two? Guys, quick ad break. We are currently taking on clients. Click the first link in the description to explore more. Back to it.
Without a doubt. Absolutely. Absolutely. So the question one I find is very motivating for me. I don't know why. It's something back in the back of my monkey brain. I love answering questions. It's very strange. Remember, I should go into teaching. If someone asks me a question, they're genuinely curious and they have maybe a little bit of a guide and they probably align themselves with some version of an answer. I usually go through the same steps of like, okay, well, generally this is what my approach to the situation is. And then I provide a little bit of a backing of why I think a certain way. So in the case of are shakes okay to lose weight? I'm like, well, if your total calories are reduced, then yes, absolutely, they're a way to lose weight. Do I think they're the best way? No, because they're generally not very satiating. They're often quite expensive depending on where you buy them from. If you're making them yourselves, there's no guarantee that they're going to be satiating to the point where you would like them to be. And ultimately, I think there are better ways to approach a situation. that generally provides a fair bit of context for someone to be like, oh, all right, I never really thought about that. That's quite interesting. Or the complete opposite. It's like, yeah, but you haven't talked about this shake has that specific ingredient. I'm like, okay, so what does that specific ingredient do? If it's an open conversation, you can talk about that stuff. But in other situations, not so much. In my experience networking and chatting to all these different individuals, people in the society, business owners, just normal people, I find that it's not necessarily a open question and dialogue that you engage in. It's more of a statement validation to seem relatable to the person. So someone will come up to me and it's, oh, you're a dietitian. So, oh, really cool. I've been reading this book. I'm like, oh, interesting. What do you think about that book? Is usually what my response would be. But it's almost like, oh, dietitian, shit, he's the food police. I've got to act like I care about my health. I don't care if you care about your health at all. I care about our conversation right in front of me. I don't judge you. Like if I was to judge every person out there, man, my life would be absolutely terrible. Like you can imagine the amount of thoughts that would go through my head. Like this person doesn't do that. And that person is suboptimal in this intake. And this person does that. That's terrible. It's like, oh man, to live a life like that, that's brutal. That's like insecurities to the max.
Yeah, look, 100%. And with the shake thing, I just like to delve into it a little bit more because it's something I've been thinking about quite a lot. And I think the best counter argument to the whole shake thing is that just acknowledging that, yeah, sure, there's good evidence for it. It does work, can help you to lose weight. But if we can draw things back to the premise of that we understand the whole challenge of weight loss is keeping it off, no one really is under any sort of false pretense as to the difficult stage is losing the weight. Most people are pretty aware that the difficult stage is post weight loss and actually maintaining your new weight. Then we can kind of conclude from there that, well, shakes don't offer you a long-term solution. You're not going to be on shakes for the rest of your life, most likely. And you're not actually learning anything new when you're on the shakes. You're not building new habits that are going to be sustainable for you. You're not gaining any new knowledge by going on the shakes that you may by if you were having a certain specific type of diet or eating specific type of foods. So it's not helping you, in my opinion, it's not actually getting you any closer to achieving your goals, which is long-term weight loss and sustained weight loss. So for me, although it seems a little bit far-fetched in that there's probably easier arguments you could make about the shakes being a silly idea, just like you were saying, not very satiating. There's a lot of things that, easy to eat, quick to eat, pretty palatable. Like there's a lot of things that you could argue against them, but I think the one that's hidden in the grass a little bit is the argument I made just then, because it's not your typical kind of snap argument, but it does sink in, I think. Over a lot.
That's a very interesting perspective, and I don't disagree in the slightest. I think it's absolutely somewhere I would take a more in-depth conversation. But if someone's like, if I'm talking to someone and they've realistically only got a minute to talk to me, that's kind of like a half an hour conversation. It's like, well, what do you want out of your weight loss journey? It's like, oh, I want to be X weight. I'm like, okay, well, why do you want to be X weight? Is it for health? Is it for this? Is it for that? Generally, we kind of all come to the conclusion that we don't want to lose the weight and then bounce back to a higher weight post the weight loss period. It's probably more so that long-term maintenance. But I don't think many people realize that. I think jumping straight to that conclusion can often be like, oh, that's strange. Like, why would I think about it like that? All I want is to look good for the wedding coming up or whatever it is.
Yeah, for sure. Without a doubt. Okay, look, I think we've got a pretty good handle on how you'd navigate friends and family, loved ones, always not combative in any way. I don't think for me, if someone told me that carnivore was amazing and the healthiest thing they could do, and they were a friend or family, and I could see they weren't open-minded at all, there was just more, they were trying to state it as a matter of fact, I'm not going to try to change their mind. They're not in a position to have their mind changed. I'd be more just accepting and willing to be more very agreeable and okay, that's really interesting that you say that kind of thing. It's, I'm happy that you feel like you found something or whatever it is. I personally don't feel like it's my place to correct my friends and family. What about from the point of view, so that's one category. We had 3 more to go. Social media. Let's get stuck into that because that's definitely not my forte. And I think you probably handle it pretty well overall. How do you go about, you get a comment, people are pretty nasty at the best times on social media, but I think we've created an atmosphere. I think especially you've created an atmosphere so that people aren't that way in your comment section. When you do get the odd comment that is disagreeing with you, how do you go about navigating that?
Yeah. Well, it's so, I would approach it in a very similar manner to how I would normally approach a normal conversation, in terms of exactly like the carnivore instance. If someone's like, oh, carnivore's the only way to do it. Usually I'm on social media, I'm trying to gain a little bit of a following, because of course I want to express what my expertise is out there. I want to kind of debunk charlatans moving forward. And then I do tend to respond to these kind of people. And in the same sense, if I was to talk to a normal person, carnivore's the only way, and I wanted to engage in the conversation, it's usually a probing of like, okay, why do you think this way? How can we approach a middle ground? Do you think XYZ? Do you refute this data? Do you have a certain data set that I don't have? Is there something that I don't know? How would I navigate this situation, and is it appropriate? And then of course that's you have to weigh up, is it worth responding to the individual in the first place? Because if they're kind of just coming from a perspective of saturated fat, full stop, is the best kind of fat, I'm not even going to entertain you because I think you're an idiot. It's like we need to go back multiple steps in our logic there to kind of reassess, okay, why are you saying those kind of things? And then is there a reason why you would even comment that in the first place, if not just to get a reaction out of the individual in front of you? And it's an interesting kind of conversation. Then do I go out of my way, whether it's in person or on social media, do I go out of my way to correct someone when they may not be looking to be corrected? They're kind of just looking to express their own agenda. They're looking for external validation from other individuals, from social media, from people around the room. They're looking to get the nod on the shoulder. Yeah, fuck the health system. Yeah, the health system sucks. Yeah, it's all about like the underground research that gets debunked. Yeah, that's like the entire reason why the health system isn't as XYZ. Yeah, as far as I'm concerned, the health system is as good as it's ever been, and it's going to continue to get better every single day moving forward. It's going to be bumps along the way, of course, as there all are with things and progress, but I would very much rather be born today than I would have been born 200 years ago. Absolutely, hands on the table. So jumping on how to approach that situation, is it worth to respond? You have to weigh out that question. And then can you have an open conversation? And if not, I've kind of just left those kind of conversations. And usually after one or two responses from me, and I provide a little bit of data, provide a little bit of evidence, people kind of run out of their I guess, backing. It's like the person they've tagged doesn't respond, and the resource they supply is a single paper. But I've got 20, 30, 40 individuals' papers that can back my claims. Okay, what's the probability that I'm more correct versus what you are? And if you can make it so that you are more correct, then I'm going to agree with you. Because if I can't agree with you that when you're correct, then I'm not a very good dietitian. I'm not a very good science and evidence-based practitioner. Like, it doesn't make sense that I would sit in my golden throne and then, no, you're incorrect because I thought about it this way. Yeah. What are your thoughts on that approach, Max?
Look, what I hear from you there is exactly the way that we try and navigate our business and run our business, really, is through, there's the biggest one we have, which we're still trying to learn and trying to get better at, is the whole metabolism thing and learning about metabolism, learning about individual variability and intra-individual variability between people. And there's a whole range of things to know about metabolism. That's what me and you are trying to learn. And it's something that's, just to be super clear, there's articles out there from people that we respect, which we actually disagree with. And so we want to make sure that we're absolutely right before we go ahead and make a public statement as to what we do disagree with. But yeah, exactly your point there is that, like, we're more than happy to be, as long as there's evidence being shown whichever way, more than happy to be moved in any direction, really.
Absolutely.
But yeah, look, from my point of view, I'm very much don't engage at all really on social media, unless there's a comment that someone would be as polite as talking to me face to face. I'm not going to bother engaging. I got a great comment from a friend of ours a few days ago, which was amazing. And I was, very polite and respectful, being like, hey, look, I think you're wrong on this kind of thing. And there wasn't much of a back and forth, but he made a great point. And so, like, I absolutely responded to that. But yeah, most of the time, if the comments aren't like you're actually talking to someone face to face, I'm not going to bother.
Yeah, not constructive in nature. They're just kind of there to get a click or a reaction, I guess.
Exactly. Sorry, I've got like the worst fly in the world. But I think the third one is probably the one you can delve into most here, which is which is probably the most interesting and the most would be variable between clinicians, is when you're seeing someone, when you actually have a client. What are you doing when a client says to you, Matt, I swapped out, you go through their diet history, they have heaps of lactose products. They have lactose here, lactose there. And then they go, oh, Matt, I swapped out for Weet-Bix in the morning. I started having lactose-free milk. So no, I started having A2 milk. No, sorry. I started having lactose-free milk with my Weet-Bix, and I just feel so much better now. So much less bloating. I just feel so much better. And they're ignorant to the fact that, and they think, Matt, so I think it was because I was just lactose intolerant. I think that's the reason why. And that's why I'm feeling so much better now. Ignorant to the fact that they're having heaps of other lactose products throughout the course of the day. They think the only thing that has lactose on it is milk. What are you doing? Like, how are you navigating that situation? Because obviously I've got my ideas how I discuss it, but what are you doing with the client?
So
do you want to say it again?
I kind of get it. So if I was to summarize from what I understand, clients come up, said, hey, I feel better when I've cut out lactose in the morning through my specifically just my cereal, but I'm having lactose throughout the day in different portions. They're not aware of that, but you can gather that information from the conversation.
Yeah.
Okay.
Yeah.
In that instance, I'd like to explore a little bit more. So in a client consultation, I have an obligation to provide as much information as I can in an accurate source and evidence-based manner. I can't let things slide unless it's such a big element that it's going to take multiple sessions to kind of get through that block. Like if it's, I don't know, if someone says, whenever I feel fat, like I feel bloated and terrible and this and that. And I'm like, okay, that's such an emotionally charged statement you just made there. I'm not going to break through anything in just a couple of minutes with you. I need to work with you over time to reframe and look at your personal outlook in a different perspective. We need to acknowledge and work around this situation. But if it's something like, I think it's like maybe I'm lactose intolerant. I think that's why I'm feeling better with switching to milk. Let's explore that. Let's go through that information. Is it that you are lactose intolerant? Okay, I generally tend to believe people when they tell me things because they actually believe it. And there's often merit. You are the expert in your own body better than I am. I'm not sitting in your own body. You have to explain to me how you feel through your brain and through your mouth in words that we can come to a conclusion together. In that conclusion, working together, are you aware what lactose is? What do you think lactose has? Do you think there's anything else that you change in the morning? Can we explore this a little bit further? What do you think the change has made? And potentially, if it is lactose intolerance, which there definitely is a potential for it, is it that a certain amount can provide symptoms versus if we have it spread throughout the day, then that's below our threshold of symptoms, then yeah, you are lactose intolerant to a certain extent. There's a wide variety of yes or no. It's not like an anaphylactic reaction where it's, well, even that has a certain tolerance, but it's not like an anaphylactic reaction where it's a very little amount and it's kind of a cascade of inflammation and events that go from there. It's usually a general dose-respondent relationship. A little bit of lactose, a little bit of symptoms, a lot of lactose, a lot of symptoms. Usually we kind of explore that relationship a little bit more and then come to a conclusion together. But if it's, it really does range in the comment, but generally I correct people a lot more because that's what they're expecting. They come to be corrected. They come to have an expert's advice. They come to get what the actual evidence is versus just seeking validation in a conversation, because then they wouldn't be coming to see you personally and privately.
Yeah, look, it's interesting. I think maybe the lactose one wasn't the best example. If maybe I had have said something dumber, something that was mad, I swapped my cucumbers for lunch, swapped that out for tomatoes. And I used to have the worst bloating for the cucumbers, man. And now it's just amazing, just feel incredible now, so much more energized and everything. Would that change the way you're going to approach the conversation?
Well, potentially, because cucumbers do have fructose as a FODMAP. So, like, I mean, maybe it's not the best choice of food again. But let's say fructose is not a FODMAP that you're sensitive to. Then I'd be like, okay, well, why do you feel this way? Is there a certain thing that we go around it? I guess it would almost be the exact same situation, but I'm acknowledging internally that there isn't a reason for you to feel this way. Like, it doesn't make sense from my head. But if you're adamant that, hey, cucumbers, full stop, make me feel terrible, then I'm going to believe you. Then we reduce cucumbers and, of course, aim to reach the nutrient requirements that we can from other foods. Like, it's not like it's the biggest deal in the world cutting out a single food. But if it's like, hey, every single vegetable I ever eat makes me feel trash. Like, I feel absolutely terrible. My autoimmune dysfunction flares up. It's like, okay, that's a big deal. That's an entire group of foods that we potentially cut out, an entire group of nutrients that we potentially can't get. Like, my initial thought is, man, your cancer risk is going to go through the roof for bowel cancer just because we can't get enough fiber in on a daily basis. Let's go through a process of dietary elimination, very strict elimination diet to what you are doing at the moment. And then let's gradually introduce different and key specific foods, which we know are not very, let's say, which people agree with more often. And let's slowly introduce it, see if there's any change over time. Because I think it's the same approach where it's like, I have a little bit of IBS symptoms, so I'm going to go full FODMAP, cut out every single FODMAP forever. It's like, man, I don't think that's helping you here. I think it's like, yeah, it'll reduce your IBS symptoms, but like the amount of stress you have to go through and potential hunger from not being able to eat any food at a particular restaurant, that sounds like an extensive deal that isn't just easily switched away. Like, we should explore these things further and have a conversation rather than taking it at face value. It's like kind of it all, like, cut it out, finish, done. And then what I find often with these things is it's the same sense of the yo-yo diet. It's cutting everything out, or for some people it's probably more relatable with lactose intolerance. Cut out any lactose at all. Man, I really miss cheesecake. I just want cheesecake so bad. And then I'm just going to pig out and have an entire cheesecake in front of me because I just love it so much. But if we work at it over time and we decrease our sensitivity to lactose over time, then yeah, you can absolutely have a small slice of cheesecake. You can have your diet and eat the cake at the same time without having to feel like absolute trash from a GI bloating perspective. Like, it doesn't have to be the way that you set things out to be. We don't have to, if we want to lose weight, we don't have to cut every single thing out. As we've gone through multiple times in this podcast, it's a very, very small kilojoule change over the entire day, over the entire week, over the entire month that really makes those changes over that long term. That's just my general thoughts of the situation. Sorry, I went on a bit of a rant again.
100%. And you can have your lactase tablet as well. You'll be absolutely fine.
Yeah.
I did
have a conversation the other day with a client, and she was actively against lactase. And I was a bit confused. I'm like, why? Is there a reason? She goes, oh, no, I just prefer to do it naturally. I'm like, okay. Lactase is a naturally occurring enzyme. We just kind of concentrate it in a pill. It's like the same as the supplement that you're having in the morning. It's just like we've just concentrated a different form of an enzyme. Like, it's not, I don't know. I think it's quite simple from my perspective, but a lot of people have that trouble differentiating between like something that's synthesized in a lab versus potentially formulated in your garden and someone's crushed a bit of turmeric and put it into a little capsule. Like, it's the same thing from my perspective. If the garden's probably a little bit more, let's say, unsanitary.
The reason why I was probing you so hard, Matt, is because I actually disagree with what you're saying.
Please spill the beans.
There's a lady called Mel. Her name on Instagram is Regressive Underload, which is funny. And she made a great post of probably 3 or 4 years ago now, I'd say. And it was around this very topic, this exact topic of when a client comes to you, they feel amazing from a placebo effect that's meaningless, swapping out the cucumbers for tomatoes or something really silly. But they feel amazing.
Remember to check the link in the description or our website for our consultations. Back to it.
Her whole point of view was you need to completely remove your ego as a clinician, as the authoritative figure who needs to be correcting people and only spitting facts and everything, and just let them enjoy their placebo and let them enjoy them feeling amazing. And you don't need to correct them. Just leave them. Now, I'm not saying what you're saying is wrong. I think it's just different perspectives. You know, it is scary. For example, that person, we've had a one-on-one session with this imaginary client who's told me that they swapped the cucumbers for the tomatoes, and I let it slide. I go, oh, that's amazing. I'm so glad you're feeling so much better. Yeah, and then we talk about a whole range of things. And then she goes and tells someone, right? She goes and tells her friend who's a nurse, or she goes and tells a friend who's a doctor or whatever. And the doctor goes, wait, and the dietitian didn't say anything to you about that? He just let it slide? And then so it looks bad, right? It looks like the dietitian knows nothing. The dietitian's stupid, doesn't even pull you up on the most basic stuff. So there is an ego thing around it. There is an ego thing of that you need to just, in my opinion, you need to just drop the ego and let people, if they're feeling good, don't crush their dreams. What do you think about that overall?
That's such an interesting take. I neither agree nor disagree, but I don't know how to exactly express why I feel that way. So I agree with the statement of don't crush people's dreams. Because if you're like, hey, when I eat cucumbers, I just feel amazing. Like I feel like the best person I've ever felt. I can feel physically insane. I'm not gonna be like, no, that doesn't make sense. You're silly. Stop eating cucumbers because that doesn't make sense. It's like, yeah, if it feels good and it's providing a positive influence on you, then absolutely. And I guess you could almost say the same thing for removing something. I guess the worry I have when you switch it around and you're removing something from your diet is then, are you going to do that to something else? And then is that going to expand? This is probably not, let's say, a very logical process. But if we are able to do it to one thing that doesn't seem to have any evidence base or logical base behind it, it's just like, I just chose cucumbers and now I feel better. It does seem to me like it's providing a placebo. And I do feel the obligation to be like, hey, just to be aware, when we have this conversation, I don't see any evidence supporting why you would feel this way when you remove cucumbers. But all I'm here to do is provide you the information and you to make a decision. So if you're feeling better when you remove cucumbers and introduce other fruit and vegetable, as far as I'm concerned, it sounds like a benefit from your perspective. And from my situation, the nutrition, let's say, sidestep is negligible. I wouldn't stress too much about it. But just being aware that I don't really see too much evidence behind it at this point in time is the way that my conversation would actually go. If it's like, hey, I cut out this, they have nothing to do with each other, but I've noticed that I feel better. Okay, maybe there's actually something behind that entire situation. Do we have a specific food chemical sensitivity that I don't know? Because let's be honest, there's a lot of food chemical sensitivities that we don't know. For example, as far as I'm aware, salicylates tends to be one of the more let's say, one of the more sensitive topics where we don't have very good guidelines for it. Some foods have higher salicylates, some foods have lower. And then depending on how you respond, you can respond to some foods that should have a higher total level than other foods. And then we don't have a very good, let's say, database for it. So if I was to say, oh, you're sensitive to salicylates, I'm like, okay, cool. Give me some guidelines for what foods have salicylates. I'm like, okay, it's all these foods. But it's to the point where I can't tell you which one has higher, which one has lower. It's like we can say very confidently which foods of lactose which like dairy or foods in general have higher lactose and which foods have lower lactose. We can have an index, a baseline, a guide, a data set for it. But I can't say the same thing for a specific food chemical that I'm not very familiar with and the data just doesn't really support from a practical application perspective. So that's kind of why I feel the need to at least express where my opinion comes from, because if you, exactly like you mentioned, Max, if you don't mention something, and I've done this, that's my gut reaction in before. I'm like, some clients have come to see me about a thing they've gone to see a dietitian before 20 years ago. And it's like, oh yeah, I saw this dietitian and like, blah, 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 blah. And I go, oh, did they say anything about this specific part of your diet? And to me, it's very, very obvious. They go, no, not at all. I'm like, okay, well, is it the one or two conclusions? One, they're inept and they missed it. Or they've addressed it at a later date or were planning to, and the client never came back, which is often very common. Like it happens all the time. I've planned out my entire plan for this client for the next 2, 3, 4, 5 months, and then they just bounce after one. I'm like, okay, that's absolutely, you're right, not a problem at all. But you've only gotten a tenth of the service that I would have provided for you. Some things to consider, I guess.
No, definitely. And I think you've really got to be confident in your own knowledge and confident as to distinguish between what's meaningless and essentially not harmful at all, harmless, versus something you need to correct because it potentially could be harmful. And then, and figuring out that balance and how you're going to navigate that situation as well, because obviously if there's something where the client's displaying something that might be harmful towards them, you're going to want to flag it and bring it up. I think it also comes into point as well, just to be super clear, is that if the client's asking you any questions, you're always going to be very, very upfront. You're never going to lie to them. They're not like, if the client comes to me and goes, oh, I swapped cucumbers for tomatoes, what do you think about that? I'd go, I mean, I'm happy that you're enjoying it. Like, oh, do you know why I'm feeling so much better? I'm going to be honest, I've got absolutely no idea. Couldn't tell you why. And I might even go, look, to be honest, in my opinion, from what I can gather, potentially could just be a placebo thing. And it could just be a, thing that you're having a positive association with this. And, there could be other things going on in your life, which is making you feel better. And it might not be actually related to this single food swap, and just discuss that. So of course, if there's a question around it, you're going to answer it thoroughly and properly. But I think it is good to distinguish between questions and statements, because we do want to assess whether the people speaking to us are open for critique or open to hear information, or if they're more just saying something as a matter of fact and something they're not willing to change on at all.
I'd love to know your perspective of how applicable that generally is. So if they're just stating, we're going through a diet history, like, I had this for breakfast, I had this. I used to have this food, but I now switched to my cucumbers for tomatoes. Usually we go through the diet history. I'll make a couple of notes on the side. I'm like, oh, awesome. Okay, so I've gotten a fair bit of information from you. Is it okay if I ask a couple of questions about certain food choices? Usually, if they come to a dietitian consultation, they're very looking to have questions posed at them, and they're very receptive for, ask the questions away. And then we can go through that. But if the person's like, let's say they're very defensive about it. It's like, well, my auntie did this, and then my auntie, and then my other auntie, and then my grandmother, and we all have this sensitivity to tomatoes. And I'm like, okay, or to cucumbers. I'm like, okay, cool, no problems. Well, look, if you're that convinced that the cucumbers are negatively addressing your health, then we'll leave it for now. It's not the biggest priority. Usually we have a bigger priority in the dietitian consultation, like a comorbidity, type 2 diabetes, calcium deficiency, iron deficiency, osteoporosis, things that actually matter, rather than a cucumber to a tomato. Like, it's all about prioritization. What are we actually talking about? If you come up to me, you're like, hey Matt, my IBD is really, really bad right now. I'm concerned about it. I'm at my wit's end. There's nothing I've tried that's worked. I have all these like potential symptoms, and I think some foods are really causing the trigger. But it's like one of those situations. And I go, but like, how many minutes did you sleep past your specific bedtime? Like, was it like 2 minutes or was it 3 minutes? Because I'm aware of the circadian rhythm, and it really influences how you sleep. And I think that's what's really influencing your IBD, and not by like hours or anything. I'm talking like literally like seconds. What are your priorities in that situation? Like, you're kind of just throwing something on the wall, hoping it sticks, and trying to act professional. I don't know.
You're just trying to health max. You're just trying to health max the client. That's all.
Yeah, it's a fake optimization. Is there an actual term for that?
Nah. I feel like it's always max. It's like looks maxing, I think, is what it's called for physical appearance. But
health maxing, yep.
Okay, final one. I think I feel like that's been pretty rounded out. What I'll try and do is I'll have a quick look at our Instagram, because it was a long time ago. I'll have a quick look through and see if I can find the actual post itself, and we can open with that next time or something if it's interesting enough. Final thing is people you really aren't close to at all. So strangers, associates, how, as you were saying with your networking, you get lots of people throughout the networking. They'll say statements and they'll say things about they've read a book. what are you doing? How are you navigating that?
Yeah. Usually just yeah. And then we move on the conversation, because if they're just stating something, they're just looking for potentially a way to make conversation, or they're looking for validation, or like on the very odd occurrence, they're testing me. Usually you can tell when someone's testing you. It's like, hey,
Oh, really? Okay.
yeah, it's like, oh, I read this book, and they're kind of waiting for a response. I'm like, okay, let's look into it. Sure. What did you think about the book? Like, what are you thinking about this? Not very common when people are testing, but it's usually like in a more in-depth conversation. Like it'll be someone used to be a PT, and then they'll start whipping out like health facts, and it's like, here we go. It's a dick measuring contest. I've got to whip out my health facts too, and I've got to prove that I'm better than an ex-PT. Oh, here we go. Not very common, but yeah, look,
exactly.
It does tend to happen.
I know exactly
usually
what you mean.
A conversation starter rather than let's say something to actually explore, especially in a public setting. Look, I've got 20 people around me. They're potentially talking about your health, which can often be a very private experience. Some people are very open. I've known many people to be very open about their health. They'll tell me everything and anything in front of a stage of 200 billion people, versus some people who, if you ask them if they had a cold last week, they will not acknowledge or appreciate the conversation.
Yeah. I think you hit the nail on the head, and that happens with a lot of people, is that they, because those first interactions with someone can be kind of awkward. So you just cling on to anything, and you need to be really adept. I think it's adept is the correct word. Adept to differentiating between what's a conversation starter or just something to talk about versus whether someone's actually curious or interested about something.
I'd love to know your perspective. So if I was to pose, my name's Jane. Jeff. Jimmy. Jimbo. Hey, Max. Oh, you're a dietitian. Cake's so bad, isn't it? How bad is cake? What is your response?
I love cake.
I love cake too.
I'd be like, oh, Jane. Yeah, Jane, that's so funny. No, look, I love cake. You know, I got absolutely nothing against cake. I think cake's awesome. It's so yum. I love cheesecake the best. What's your favorite cake? Just like I think complete
cake. What? World flipped upside down. Everything's in ruins. You can see the catastrophe, the 7 layers of hell going through their mind right now. It's just like, what? Dietitians think they like cake is usually what happens.
Yeah. I always just try to completely negate any sort of preconceived notion, because the preconceived notion is always food police, always everything. And the more you can be not that and display to people that you're not like that, you're not that kind of guy, then it creates, I think it really only is a positive atmosphere. It creates a positive atmosphere and has positive connotations for it. You know, better, more open atmosphere, more honest atmosphere, more likely to engage, more personable. There's so many more things that it creates that, rather than saying, oh yeah, no, you're 100% right. Yeah, cake's got so much saturated fat in it. It's just, your blood sugar level is going to spike, and then if you go to more birthday parties, you're going to be, I'll see you in the dialysis unit, we'll be there together kind of thing. Like you're going to be, it's just have fun engaging with people and getting people to listen to you when you're saying stuff like that.
You said something during our education, which I think was something that's really stuck with me. I'm not sure if you even remember it. So we were learning how to take a diet history. And for people who aren't aware, you generally go through, it's like, okay, very open questions, not very direct questions. Like if I was to ask you, hey, how much toast did you eat this morning? You're guiding someone to answer in a number of toasts, when in reality, they could have not eaten anything. So if I was asked a question, hey, what's the first thing you ate today? Very open. Could be, oh, I had a biscuit at lunchtime. Versus, yeah. So we get the idea. Your position was, in terms of chocolate, someone says, oh, I had a block of chocolate. Or sorry, like as in a square of chocolate. Your position was immediately to be like, oh, awesome. I love chocolate. What is your favorite flavor? My favorite flavor, I can't even remember what you said. I usually go with caramel because it's true. I love caramel chocolate. And then you see a switch in someone's mind. Yeah, it's like, oh, dietitian likes chocolate. Okay. Yeah, I really like Cadbury normal chocolate. And then you wait for them to tick it for a second. And it's like, but if it's mint chocolate, I'll have like a quarter of a block. Like I really, really enjoy mint chocolate. You never would have gotten that information if you didn't build up that rapport and actually express that you're a human too and you like chocolate as well. Which I think is another element where it's like, okay, you can be honest, and it potentially is providing additional context and maybe, let's say, not having an open conversation, an open questioning position, but gathering the information you need by providing an additional, let's say, emotional context.
Yeah. And just for some context around what Matt said, the instruction that we get when we're doing those diet histories is to remain extremely neutral throughout the entirety of the diet history. So it doesn't matter what they say. If they say I had 2 Weet-Bix with orange juice and 4 tablespoons of coffee grind sprinkled over it, literally just neutral. Like, yep. What did you have? Anything with that? What sort of coffee was it? Or something like that. Like just very, very neutral. But yeah, I guess I kind of had the approach of that if we can understand and it's acknowledged across the board that patients, clients, people who we are the recipients of this diet history, if we can all agree that they underreport and, potentially don't remember everything, if we can coax them as much as we can to remember stuff and develop that relationship throughout, I think it can't hurt, maybe, but it'd be amazing to get someone on who would dispute that. I think my supervisors would dispute that in general. And so, I did use that. I did utilize that, when someone would say, have chocolate black, and it always comes from a genuine place, right? Because I do love mint slice chocolates, but like, oh yeah, mint slices genuinely amazing. Like I love them so much. And it's not, so I'm not lying. I'm not trying to probe them anything. I'm just like literally just making a comment as to what I do and I don't like. I think it's cool. I think it's a good idea, but it would be cool to get someone who actually has a brain to dispute me.
Yeah. I haven't found anybody who doesn't necessarily agree with that approach just yet. Because I think...
Oh, really? Okay.
Well, it really does depend. So you have some individuals who are just like, just get the information, that's all you need. But then those kind of people, I think they generally think that the human that you're trying to talk to is a perfect person where their memory is infallible. I think that's how you say it. And everything is perfect about them. If you ask them what they had 72 hours ago, they'll be able to tell you to a T. I can't remember what I had yesterday for lunch. And I'm a dietitian and I focus on food all the time. Like it's one of those situations where if you don't provide additional context and you don't build up that rapport and that honesty, like if you're sitting there, did you have your source of vegetables today? How many serves did you have? Man, way to kill the vibe. That's a terrible conversation to have. But if you build up the rapport, you have an open conversation, you actually talk to a person rather than talking to a set of data that you need to evaluate and acquire, you can change the entire route that the conversation goes and the consultation goes in extension.
Yeah. I think the reason why is because it's the safest approach to have that neutral. That's why we get taught that way, is because it's the safest. Because most people, especially dietitians, because they're so prude when it comes to food, if the client displays any sort of, what would be like food for like positive health outcomes. So, fruits, vegetables, any like those kinds of food, like, legumes, what would have been found during the training process and like throughout the evaluations would have been that the dietitians would have been promoting those foods. So making small comments about, oh, amazing, great choice, kind of thing, or whatever it was. Yeah. And so then if you're saying, if we're at breakfast or if we're at lunch and I'm doing a diet history on you and you're noticing that every time you have legumes or every time you have a fruit or some vegetables, I'm promoting that, you're going to be more inclined to remember those and potentially hyperinflate how many vegetables and how much fruit you're actually having. So I think that's why there was the neutral approach was taken. And I guess mine's kind of the inverse of that, in the sense that let's not focus on promoting vegetables and fruit, because if we're being honest, everyone we're doing a diet history on anyway knows that's what we're secretly looking for, like a lot of the time. And so if you can kind of inverse it and promote the things that most people know that we don't really want to come up very much, then it might actually cause it to balance out in the end.
I think
Maybe.
the neutral approach is the cookie cutter. And while the cookie cutter can be done by any robot, I don't want to be a ChatGPT bot. If you want a ChatGPT, just go and search for it. Like, you can have that conversation. You can ask it to be a dietitian, and it can give you the cookie cutter approach that's not personalized to you.
100%.
But if I know that immediately we have a conversation and you have a sensitive topic around certain types of foods, I'm like, okay, well, let's explore that a little bit. I'm not gonna judge you for anything. I need to gather this information, and I need you to be honest. And I think we should build up a relationship to get that information, rather than, are you sure you had the chocolate? I really like chocolate. Did you have chocolate? It generally doesn't go amazing if you push a conversation like that.
100%. Exactly. And
if we were to round out the conversation, Max, so jumping back to the general, let's say, if we were to say, how often would you actually correct someone on like a daily basis? If we were to say percentage wise.
Sorry, can you just repeat the question for me?
Sure thing. If I was to say, how often do you actually correct someone on a daily basis from like a total percentage wise?
Never, ever. So I always really take it back of that. I'm like, this is a really bad analogy, but I can't think of anything else other than like your old housewife in the 1700s or 1800s, don't speak unless spoken to, kind of thing.
Right.
Of that, if someone says something towards me about nutrition, I'm, amazing, good to hear, that's super interesting. If anyone asks me a question, I'll give them a super detailed, super thorough answer, as long as they're not getting bored. Like, I don't want to bore people. But yeah, I'm more than I again, just same as you, I love answering any questions. If anyone is somewhat curious, it's my bread and butter. I absolutely love it. But yeah, I never want to overstep. I think that's something I really want to. It's one of my goals, to make people feel like I'm not burdening myself onto them.
That's such an interesting perspective. I was under the assumption that I would be correcting people less than you, but I think I'm more. I think I'm potentially like certain things where I would say the vast majority, 90% of the time, if you make a comment or you ask kind of ask a comment question kind of thing, I'm not going to give a response unless you're actively looking for what I say.
Yeah. Interesting.
But I think like a good 10% of the time, I'm like, I don't think you need to cut out your bacon because of your type 2 diabetes and blood glucose. Like, I think bacon's okay in moderation.
Yeah. Just to be super clear, the only people I actually will correct will be health, when I'm speaking to health people.
Oh,
so
absolutely. Yep.
I was speaking to, and I'll pretty much do that without fail, just because I hold them to a higher caliber and they're meant to be authoritative on that area. So I'll always pull them up without fail. So I was speaking to a physio back in 2021, and we're speaking about just like back stuff, like it wasn't nutrition related stuff, and she was saying stuff that I was like, that doesn't sound right. And I was like, look, I'm going to be honest, like I don't usually pull people up because I don't like it. It's not my style to pull people up, but you're a physio and this sounded off. Can you take me through what's going through your head, kind of thing? So I will, without fail, if I hear anything from anyone in allied health, any sort of health sphere, and they're saying anything that I think is wrong, I'll go out of my way.
Yeah. The same applies to me. Absolutely. And I think the higher your qualification goes, the more I'll question you. And people absolutely hate it. Like, you question a doctor, it's like, oh, you can't do that. That's scandalous. Like, that's terrifying. You can't question a doctor. He's a doctorate and he's a smart person. It's like, yeah, but like, yes, they know a lot of things. Absolutely. But everybody can be wrong. Myself included.
Yeah, for sure.
Absolutely.
Everyone is wrong.
Well,
everyone is wrong. Absolutely. In some aspects.
Yeah, without a doubt. There's nobody that's perfect. There's nobody that knows everything. And often I find that if we think we know a lot about a certain topic, especially nutrition, which is such a gray science. There's nothing that's absolutely definite. It's often very, things generally go this way. This is usually what leads to this. There's very few causal relationships in nutrition, and we're usually working off with epidemiology data. You come to me and say, hey, Matt, why do we give type 2 diabetics carbohydrates? We should just cut out all the carbohydrates. I'd be like, okay, where have you come from with this? Like, where's this? That's such a black or white scenario. That's not how nutrition works. We don't have the data to support that kind of statement. Yes, I may generally agree a lower carbohydrate diet may be beneficial in someone who's type 2 diabetic, but we need to assess the entire situation. Are they type 2 diabetic because of like a genetic dysfunction where they have just a high proclivity to it, and even on a very low GI diet, they still have really high BGLs? Then I would say, well, it's almost pointless, because even if you remove every single carbohydrate from the diet, they're still going to make glucose from the breakdown of fats and protein throughout the body. So what are you going to do then? You're going to take the glucose out of the cells, you dumbass, you're going to kill them. Ridiculous. But that's the kind of situation that you would actually have to have that conversation and make sure that they're not spreading misinformation when they're an authoritative figure as well. And the same goes for naturopaths, osteopaths, physios, OTs, speech pathologists. We all need to come to a collective evidence-based approach. And we can all have our different views, absolutely. But we need to ensure that if we have our views, we can back it up. And we're not just saying it because, well, a couple of my clients felt really good from this. It's like, that's honestly not enough, mate. Like, you can say that in a certain couple of instances, but you need to be very honest with like your statements like that. It's, hey, I give this treatment to every single one of my clients because I fed it to 2 of my clients and they had a really good response. You have your studies in N of 2. You need to reevaluate what your data set is and then reprioritize where you're actually giving information to.
100%. Thanks so much for listening, guys.
Thanks.
Peace.
Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.